Health Ombudsman Professor Malegapuru Makgoba's scathing report on the death of Shonisani Lethole has exposed negligence at the hands of doctors, nurses and staff at Tembisa Hospital. In the past, challenges rocked the facility from incapacity in the maternity ward to allegations of ill treatment. We now focus on the hospital this morning, which is now under new management. For more developments on this, I'm joined by our reporter Pelane. Phakgadi. Pelane, a very good morning to you. The spotlight under Tembisa Hospital with the expectations expected of the hospital, seeing that it's now under new management.
Definitely, Mpona, I'm going to tell you that that particular case that you now mentioned, it is not the only case, there's quite a number of them that had come through from the Tembisa Hospital in itself. And the new management really coming through to say that they are intending on sweeping clean the area and ensure that the hospital now under its new management, it is able to deal directly with challenges that it also include, those unwillingness from some staffers at some point, and as well as some gross negligence. Joining me now is Dr. Ashley Mthunzi. He's the new broom that looks to sweep clean as the CEO of the hospital. Thank you for joining us on 405 here on Newzroom Afrika. Just perhaps the first question I'd like to ask is consequence management. Let's now deal about that. I'm sure as part of it in your new management skills, you want to deal decisively when there are gross negligence challenges that might come through, as opposed to waiting for an output from the health ombudsman, Dr. Malegapuru Makgoba, or whoever else who might be doing some investigations in that regard.
Yeah, disciplinary is in two prongs. It's a carrot and a stick. There's a carrot and a stick approach, and the stick would then be actually the disciplinary that would be meted against anyone who is not adhering to our SOPs, who's not adhering to our protocol, clinical governance protocols that are there actually to safeguard patients and to ensure that patients are safe in our hands. But the carrot is actually us being intentional. Being intentional in addressing actually the shortcomings with regards to issues of governance, clinical governance, and also corporate governance. Meaning, we must be able to reward staff. We must be able to reward staff for the hard work that they've put in. Remember, I always say that in any institution, there are men and women waking up every morning to come and make a difference actually in the lives of our people. And I say this, amidst COVID-19, people, men and women would wake up every morning and ensure that they actually come and make a difference in the lives of our people. So those people must be applauded. We must be able to applaud the people who are doing well, give incentives, motivation, extrinsic motivators, motivation of sort, to actually staff that are making a difference. But those actually who are not adhering, obviously, we must be able to provide a stick.
I should ask though, when you came in, I'm sure you were shocked, like many South Africans, when you heard of the case of people being starved to death. We had that case some time ago. We had that case, which is still currently at the Constitutional Court, of a mother who gave birth to a young son who she unfortunately was not taken care of during labor, and the child came out brain damaged. She's at the Constitutional Court hauling you guys here, and they are waiting for an outcome in that regard. Surely those are some of the things that you want to prevent going forward?
No, definitely. We believe, I believe that patients actually don't remember the big things that you do for them. They remember how you treated them at the point of vulnerability. And for offering somebody food is actually, a gesture that you would remember at a point of vulnerability. So I mean, we did actually an exercise. Pelane, to tell you the truth, we did an exercise. We took the management team, the EXCO team, to come and taste, or to go down on the ground and taste the food that we provide to our patients. Whether it's healthy options, whether actually it's the food that you would want to serve your children. The management team, they came back and said, you know what, Doc, we see what you're trying to do. We need to then improve in terms of how we provide healthy or healthier options in terms of the food that we provide to our patients. It's the work that we do is restoring dignity. That is what we must be able to do. And I just want you to say, I just want to say to you, Pelane, let us not concentrate on what was. Tembisa actually is at work and is a hospital of choice, must be a hospital of choice. Tembisa is a hospital of hope. It must be a hospital of hope not a hospital of death as it's dubbed in the media.
I should ask as well, 2.3 or just over 2 million people that the hospital is expected to really cover, and that is across 3 metros, Tshwane, Kuruleni, and as well as Johannesburg. But the hospital's infrastructure dates back all the way to the 70s, and we do understand there are plans to increase capacity. Do we perhaps intend to see when that will begin happening so that the people of Tembisa and surrounding areas could better be serviced?
Yeah, by October, there'll be work that is done with regards to the ABT and expanding the mother and child. We are going to expand that. We're going to add 300 more beds for mother and child. The work will still continue even actually next year, and we'll be able to then give proper feedback. Remember, we are not in charge of those timelines, but we will ensure that we build capacity. You've made mention of the catchment. Yes, you can actually imagine demand is outstripping supply. But we must actually ensure that we provide care and not concentrate on things that cannot be done. We must be able to say, how do we then make use of the resources that are at our disposal? Currently, we are looking at our processes. We are discharging patients. We must be discharging patients when they are okay so that we create space. We are also actually looking at where the backlog is. We have implemented lean management with regards to our A&E so that our patients don't stay longer in A&E longer than 24 hours. And that fundamentally is actually us looking at our capacity inward, but also actually challenging the community as well to stop being hospicentrism. The clinics must be utilized, MOUs must be utilized, and everybody must play a role so that we are able to curtail this very traffic that we must be able to curtail, so that we can concentrate on the level 3 patients.
As we part ways, I have to ask you, COVID-19 vaccination sites here, is that adequate, and are you still able to take more COVID-19 patients as they come through?
No, we are. Remember, at the beginning of the third wave, we had 151 beds. In the middle of the third wave, we created 221 beds. Currently, we are running an operation in terms of vaccine. Our vaccine operation runs seamlessly, and it's flowing without a glitch. And we're saying that as we are encouraging as well the community to use the other vaccination site, because there is this thing to say that let's go to Tembisa Hospital so that we can get all the doctors and so forth who are here. Yes, it's applauded, but we must be able to utilize the other vaccination sites that are there, that are supported by our district health services. So we must be able to decongest. The community also is responsible in terms of decongesting Tembisa so that we're able to attend to the more critical patients.
The need to attend to the more critical patients, indeed. Dr. Ashley Mthunzi there, speaking as the CEO of the Tembisa Hospital, the new CEO that is looking to sweep clean some of the inadequacies that people find here at this hospital. There were those issues of gross negligence that we talked about, and the hospital looks to deal with under his new management for the next 5 years, indeed, to try and ensure that people can again gain some confidence in the hospital, as he said it being dubbed a hospital of death, and that he says needs to change. Mpo?
Absolutely, some much needed confidence at the Tembisa Hospital. Let's leave it there for now. Pelane, Phakgadi bringing us up to speed with the new management amidst the high expectations at the Tembisa Hospital.